Thank you for your interest in learning more about Illumacell, where we are beating cancer with light. We believe that we have the potential to take an existing cancer treatment called Photodynamic Therapy, or PDT, to a whole new level that will result in an effective new option for cancer patients. Our legal department insists that you understand Illumacell PDT is not yet approved, cleared, or licensed for human use. While we believe that everything we say in this video is truthful, you should not rely on it for your personal health. Always consult a professional. At Illumacell, our claim is that we have developed a safer and better approach for photodynamic therapy. Today, PDT is an approved treatment that is very common in dermatology clinics for skin-related issues. But we move far beyond what is done in dermatology clinics, as we claim an ability to treat solid cancer tumors that are at any stage and being capable of treating tumors at internal depths of typically 4 to 6 centimeters, which will vary with the nature of the tissue being penetrated. Textbooks will say that 1 centimeter is the maximum penetration possible, but our internal testing with an early light device shows a capability of penetrating 4 centimeters through the most difficult of tissues, bloodied cow udder. Muscles and bone can be penetrated notably easier than fatty or bloody tissues. Our current device today has more than double the power of this tested light. We already have human treatment experience in Mexico, Costa Rica, and in Canada. We believe that we have the potential to become standard equipment around the world. In summary, Illumacell PDT is a drug and device combination therapy. Illumacell provides the light device while using the prodrug 5-ALA that will damage cancer tumors. You can see that 5-ALA is a very basic molecule. It is a natural, non-essential amino acid that is the start of the heme metabolic pathway. Once in the body, 5-ALA is quickly converted to PP9, which is a porphyrin, but is also photosensitive. Porphyrins are characterized by a molecular ring. In the case of PP9, iron fits itself into the ring to create heme. The body is very familiar with all of this, which makes the use of 5-ALA for a cancer treatment quite safe. What is unique about cancer cells is that they lack the enzyme necessary to allow PP9 to metabolize further to heme. This means that healthy tissues will quickly metabolize out PP9, while PP9 will accumulate within cancer cells. So we then shine the tumor area with light, and the photosensitive reaction will kill the cancer cells literally from the inside out. To review this in pictorial form, 5-ALA is orally consumed, it converts to PP9, accumulates in cancer cells, we wait a bit, shine our light in the area, and the photosensitive reaction results in an immediate necrosis of the cancer cells. For PDT to work, the key requirements are a light source, a photosensitive drug, and oxygen. Our light treatments are cycled on and off to permit a refreshing of oxygen in the targeted tumor areas. To validate our claims, we started with mouse studies at McMaster University in Hamilton, Ontario, just west of Toronto. Since these studies, we estimate that 150 humans to date have been treated in Canada, Costa Rica, and Mexico, with no known adverse events beyond what can be common in PDT treatments. Patients will likely experience pain while the light is on. Pain can actually be a great diagnostic tool, as it tells us that cells are being impacted. There can be mild reddening of the skin, which always goes away within 24 hours, and some patients experience nausea from the drug alone. All of these factors can be compensated for. Health Canada approved us for a safety study in Alberta. Unfortunately, COVID impacted patient recruitment, but things are underway again. Health Canada has also approved us for one-off treatments under the Special Access Program. This is also known as a compassionate care or an all else has failed program. I'll now talk about these in a bit more depth. This is a summary results table from our first mouse study. For the study, we created a 3D printed cradle to hold each mouse on top of the light. As expected, we had obvious impacts on their tumors. We arranged to obtain freshly butchered pig tissue to simulate human breast and used that as an intervening barrier between the light and the mouse. The significance of having a 2 centimeter and a 4 centimeter barrier is that our light is at 635 nanometer, or red, and the medical literature to this day says that 1 centimeter is the maximum red light can penetrate into the body. Red is the optimal wavelength to trigger PP9 at depths. We conclusively proved that we can go 4 centimeters deep and still have an impact on the mouse. Further, fatty tissue is more challenging to penetrate than muscle or bone. Down in Mexico, we arranged to scope a patient to have a before and after picture for his stomach cancer treatment. On the right, 10 days later, the darkened tissue is evidence of necrosis. Our non-invasive light was able to penetrate the skin, the stomach wall, and still have enough energy to activate a relatively weak photosensitizer. This photo was taken at a home in Costa Rica. The doctor here is treating a patient who came to the house with 1 or 2 weeks to live. He had advanced pancreatic cancer, was in intense pain, and could barely walk. After 2 weeks of treatment, his pain was gone. After 2 months, he left the doctor's care and was feeling quite good. He never returned to this doctor, but we understand that he lived another 5 months, eventually dying of liver failure. Our first Special Access Program patient had an advanced breast cancer with her primary tumor extended to her axilla, or armpit area. She had multiple known tumor metastases. The skin of her breast was oozing from the growing tumor, but she had refused both chemo and resection. Her treatments are not yet over, but we can say it is looking very promising. Her breast is healing up nicely with healthy skin, and the oncologist is very pleased. A CT scan indicated that an identified spinal metastasis had disappeared, which is quite unusual. Our second Special Access Program was a very challenging situation. He had no idea that he had cancer at all, but then was diagnosed with an aggressive pancreatic cancer and told he had 4 months to live. He was also told that chemo gave him a 50% chance of living 2 months longer, and he saw little point in that. He asked for Illumacell therapy, and we started treatments 2 months later, by which time he had already dramatically declined. The pancreas is a very central organ, and we treated him from both the front and from the back. We are confident that we were able to reach his pancreas from both directions. Unfortunately, his cancer was so aggressive that we were unable to save him. This will be a 1-minute video clip that I took with his family's permission. You will notice the light cycling on and off. This cycling is done to enable the area to be reoxygenated.
You know, if something you want to move or if you need to change, you just let me know. We can accommodate. Mm-hmm. We're going to start low and slow like we did last week, and we'll go up as high as we can, as much as you can tolerate. Last week, he breezed through it.
He did really well. Last week was the best treatment.
It was incredible.
Mm-hmm. It was really good.
It's actually why I even asked you that. You know, I asked you, was it plugged in question when I said, did you actually give him the 5-ALA? Because it's so easy.
Yeah.
Well, let's hope that it goes like that. We're going to mix it up today because the last time we did the back and then put him on his back, he had a lot of discomfort in his back.
That's right, yeah.
So I was thinking that starting here, this is our hardest position, We tolerate 15 minutes of this, and then you can sit and relax.
Okay,
In the back,
good.
a lot easier.
Oh, I forgot the little things for your chair.
Oh,
The little
The wedge.
wedge. Yeah.
Little cup holder. The little cap. I think I might find that bottle cap somewhere. That would work.
Yeah.
You know what that pill, that little leftover pill? This one. No, you still have the pill. Oh no, that's
That's the one he took.
That might be one.
You can see the industrial chiller, and that exactly is what it is. What is going on here is that our LED light head is generating the light output of 20 modern LED streetlights. That's 2,000 optical watts at the surface, which will be 200 optical watts at a depth of 2 centimeters. That light head will melt if we didn't have a radiator concept of circulating fluid that needs to chill down, as well as other technologies and techniques. There is a controller system that can adjust for intensity, cycle time, remote access, and other parameters. This is a fully functioning prototype, but we are seeking funds to advance the design. Unfortunately, photodynamic therapy has a history of bad press. Earlier efforts used drugs that were strong photosensitizers in part because they knew they had a limitation on the availability of light. These synthetic photosensitizers frequently damaged the skin and healthy tissues. People needed to stay out of the sun for a month or their skin would burn. Illumacell flips the mentality of having a strong drug and weak light by having a weak drug but strong light, which we consider to be a much safer approach. Today, fiber optics are used to access any tumor deeper than 1 centimeter, but this leads to inadequate light delivery and other issues. Hospitalization and anesthetic requirements are common and always with much higher costs. Our plan is to focus on North American hospitals and clinics. Our immediate goals are to validate our claims through additional clinical trials to gain regulatory approvals to enable patient treatments to commence. After securing regulatory approvals here, we can readily reach the rest of the world. We expect faster acceptance in the developing world because they are hungry for a low-cost and effective alternative. They don't have the money for expensive radiation equipment or chemo drugs. We are a small team today that we hope to rapidly expand with funding. Michael is a PricewaterhouseCoopers trained CPA who has taken 2 companies public. Our founder is Tom Kerber, who is an expert in LED light technologies. Dr. Hummel has a PhD in medical oncology and has been involved with oncology for his entire career. He is leading our clinical trial work. Dr. Zwaziski has many years in the medical device industry and has a PhD in pharmaceutical science. Thank you for your interest in Illumacell. You may contact us at info@illumacell.com.